is Kristen and I'm a physical therapist. From the history that you sent, you have quite an extensive history with an extensive amount of pain and have suffered greatly. I wouldn't even attempt this one because of the random pain, except you've already had it ruled out by your physician. You've had a hernia ruled out, you've had some pain in your groin and your pelvis, and you've even had swelling, and so you've had all these things medically ruled out. So I'm gonna go ahead and answer the question based on that you've already done your homework as far as been really thorough with physicians. So what it sounds like to me is that you have a very hypersensitive nervous system, which is common amongst runners, especially distance runners and competitive athletes that you do a lot of distance and almost overtraining. So I'm going to show you some basic stretches, and then I'm going to show you some nerve glides that I think will help calm things down. Your symptoms you describe is that you often have pain deep in your buttocks, sometimes down the leg, into the groin and hip flexors after prolonged sitting. So you have a lot of things going on, which is often it's very common with runners and it's very common with overtraining. So I'm first going to show you a few stretches that you've probably already do that I think will help you. The first one is a hip flexor stretch. So you're going to stand, you're going to put one foot, I want you to do everything bilaterally. You're going to stand, put one foot in front of the other. The key here is that you tuck your bottom under you. So you described that you have a hyperlordosis, an increased curve in your low back, and what I want you to do is use your stomach muscles to tuck your bottom under you, decrease that curve, then you're going to shift your weight forward and you'll feel a gentle stretch here through your hip flexor. You're going to hold each stretch for 15 seconds and perform it 3 times on each leg. So you're going to hold here, you're going to switch to the other side, tilt your pelvis, tightening your abdominals, decreasing this curve, and then shift forward because you should feel it right up here in your hip flexor. So holding it for 15 seconds each side. The next stretch that you're going to do too is you're going to also engage your abs, so you tuck your bottom under you, and then you're going to do a quad stretch, but the key is that you keep your knee pointed down. You're going to probably feel it up here in your hip flexor as well, as long as you engage your abs and tuck your bottom under you slightly. Again, holding it for 15 seconds and doing it 2 times on each leg. That's going to target lengthening of the muscle tissue. Another thing I'm going to instruct you in is a general nerve glide. This should help address the deep buttock pain. With nerve glides, you want to stay below the level of pain. So you're going to slump down completely, bringing your head, chin towards your chest. And then as you extend one leg, you're going to bring your head up. Often when you extend the leg without bringing the head up, that will probably reproduce your buttocks pain or pain down the back of your leg. So we want to just stay shy of that position. So you're going to slump, head towards your chin, chin towards your chest, leg out, head up, but you're going to keep your spine stretched and flexed over. So the motion just comes from my neck. You're going to do, and then the other leg. And if you notice, I'm going to bring my toes up towards me as I bring my head, but my spine stays stretched the entire time. So this is just a gentle nerve glide which calms the nervous system down. As an athlete, you're going to think more is better, and that's not think, oh, I want to feel a stretch, but I don't want you to feel a stretch. And it should just be awkward, just you're not used to doing it and it doesn't feel like it does much. But again, you're just gliding your nervous system and calming it down. So head comes up as the leg comes out, head comes up as the leg comes out. And I'd like you to repeat this 20 times, 2 times a day. So after 20, you're going to sit up nice and tall and stretch out your back. The next gentle thing, nerve glide, that I think will be calming to your nervous system is that you lie on your stomach. Support your neck so your head's facing straight down. You're going to tighten your abdominal muscles because I don't want you to really hyperextend your back. I would like you to tuck your abdominal muscles. So when you bring your foot up towards your buttocks, your pelvis stays still. So again, we're trying to glide the anterior nerves, alternating. But if you're not using your abs, every time you come forward, you're going to get that increased curve in the low back. So I want you to stabilize here, engaging your abs, so this curve does not increase as you bring your foot up towards your buttocks. The next thing that I think will help you, again, you're going to repeat that 20 times, twice a day. The next thing that I think will help you is, again, you're going to engage your abs and just lie on your stomach, flat, propped up on your elbows. And try to hold this position for a minute. And then relax. And then do it again. This is again going to help stretch out the front of your legs, your hip flexors, get your nerves in a better position, and hopefully move your symptoms down. Doug, I hope that helps you. Please feel free to contact us with any other questions. Be well.